This one here, suitable and unsuitable emotional states in which to use. So a range of positive states where people felt that it would be a use, an adjunct, if you like, to their emotional state. I want a sort of a notion of celebration. They felt that they wanted to do. Sometimes, it's interesting. There was a proportion of people here who identified that it was that having tensions and worries was a time when they would use. However, there was also a reasonable proportion who would, in fact, not use, specifically choose not to use at that time. Depression, feeling bad. Again, a significant proportion of people preferred not to use at that time as opposed to those who felt that they might want to use at that time. So it just gives you a little bit of insight into some of the reasons why, or the factors that fed into people making choices about whether they're going to use or not. And I guess in a sense these also allude to the idea of rules, the idea that you actually are not just randomly doing this, you're actually making decisions about when and how, with whom and why, and how frequently. Again, we had a significant correlation between people who stuck rigorously, who said they stuck rigorously to their rules, versus those who did not stick rigorously to their rules. So in other words, the more rigorously you stuck to the rules, the less likely you were to be diagnosed with dependence and abuse. So the idea there is, well, gee, would it be a good thing to maybe promote rules around use? This is harm reduction. So just finishing up then, most of the participants self-identified a range of rules. Many of these rules were exclusory. Okay, in other words, they identified times when they wouldn't use, or situations where they wouldn't use, or people who they wouldn't use. Positive states were more frequently identified than negative states. Now this might be on the level of harm and of protection. We do need to acknowledge this level of pleasure. Pleasure is a very difficult one to deal with in the general discourse on drug use because we tend to shy away from it. There's a great clip which Gavin didn't show, which is Ali G. And he's a sort of UK, he's what's his name? Borak. And who's the most recent guy? Bruno, yeah. And he did these kind of interviews of real people in the UK. And he did this one with this drug expert, and he said, tell me, what are the effects of cannabis then? And this guy reels off all these negative effects, and he says, and are there any bad effects? Sort of just taking the piss out of this idea that we're only ever going to talk about the drugs in a certain way. We're not ever going to think that they might actually be doing something else. And ultimately, finally here, the more rigorously adhering to rules, people were less likely, significantly, and I'm talking statistically here, significantly less likely to receive a DSM diagnosis. And so the notion of the value of rules in a drug using context, and the notion of, this is just thinking ahead to policy and so on, and about how we can try and calculate some of those rules into people's behaviour.